Prostate cancer is one of the most common cancers among men, with over 1.4 million new cases diagnosed globally each year. Many risk factors like genetics or age can't be controlled, but what about the foods you eat every day? Could your diet be increasing your chances of developing prostate cancer without you realizing it? Are you unknowingly feeding cancer-causing cells with common choices on your plate? Stay with me as I uncover 8 foods that may trigger prostate cancer, and stick around until the end for an essential tip to help lower your risk through smarter dietary choices and lifestyle changes. Quick reminder, if you're enjoying the content, please hit that subscribe button and turn on notifications so you never miss an update. Give this video a thumbs up if you found it helpful, and drop a comment below. The first dangerous culprit is processed meats, such as bacon, sausages, and hot dogs. These meats are loaded with preservatives like nitrates and nitrites, which have been linked to various cancers, including prostate, colon, and even liver cancer. Cooking these meats at high temperatures, like frying or grilling, releases carcinogenic compounds known as heterocyclic amines, HCAs, and polycyclic aromatic hydrocarbons, PAHs. Studies in cancer research show that frequent consumption of these meats significantly raises the risk of cancer development, including aggressive forms of prostate cancer. If you consume these often, it's time to rethink your protein sources. Lean poultry, fish, or plant-based alternatives can help protect your health. Next on the list is dairy products, including milk, cheese, and yogurt. Research has found that high dairy consumption is associated with increased levels of insulin-like growth factor, IGF-1, a hormone that has been linked to the growth of prostate cancer cells. Excessive intake of dairy may also increase calcium levels, which some studies suggest could reduce vitamin D in the body, a critical nutrient for cancer prevention. Men with a high intake of dairy may be more susceptible to developing prostate cancer and other cancers, such as bladder or esophageal cancer. To reduce your risk, consider switching to plant-based milk like almond or oat milk. Fried foods are another major trigger for prostate cancer. Foods like fried chicken, French fries, and onion rings are cooked in oils that release harmful free radicals when heated at high temperatures. These free radicals can damage cellular DNA and promote tumor formation, leading to cancers like prostate, skin cancer, and even stage 3 lung cancer. Additionally, fried foods often contain trans fats, which increase inflammation and oxidative stress, 2 factors linked to cancer growth. Cutting out fried foods or switching to air-fried or baked alternatives is a small step that can have a big impact on your health. Another food to avoid is sugar-sweetened beverages like sodas, energy drinks, and sweetened juices. Excess sugar intake not only fuels inflammation, but also contributes to obesity, a known risk factor for prostate cancer and other cancers like uterine or liver cancer. High levels of sugar create an environment in the body where cancer cells can thrive. A study by Cancer Treatment Centers shows that men with high sugar consumption are more likely to develop aggressive prostate cancer. Instead of sugary drinks, choose water, unsweetened tea, or infused water with fresh fruit to stay hydrated without the risk. Red meat, especially when consumed in large quantities, is another food that has been closely linked to prostate cancer. Similar to processed meats, cooking red meat at high temperatures produces cancer-causing compounds like HCAs and PAHs. Studies in cancer research indicate that men who consume high amounts of red meat are at an increased risk for not only prostate cancer, but also colonoscopy-related issues due to colon cancer. Limiting red meat and replacing it with plant-based proteins, fatty fish rich in omega-3s, or legumes can significantly reduce your cancer risk. Alcohol is a hidden danger many people don't associate with prostate cancer. Heavy drinking has been linked to several cancers, including liver cancer, stage for lung cancer, and esophageal cancer. Alcohol weakens the immune system, increases inflammation, and creates a toxic metabolite called acetaldehyde, which can damage DNA and promote tumor formation. While moderate drinking may not drastically increase your risk, consistent heavy alcohol consumption is a major concern. For men with a family history of cancer, especially prostate cancer, reducing alcohol intake is a critical step toward prevention. High-fat fast foods like burgers, pizzas, and fried snacks are also problematic. These foods are not only calorie-dense, but are often loaded with unhealthy fats and chemicals that promote inflammation and hormonal imbalances. Chronic inflammation is a known driver of cancer development, including chronic lymphocytic leukemia and prostate cancer. Moreover, these foods are devoid of essential nutrients your body needs to fight cancer. Adopting a diet rich in whole foods, vegetables, and healthy fats from sources like avocados and nuts can help counteract these risks. Lastly, artificial additives and preservatives found in packaged snacks, frozen meals, and processed foods can pose serious risks. These additives include artificial colors, flavors, and preservatives like BHA and BHT, which have been linked to cancer in animal studies. While their exact role in human cancers like prostate cancer or lung cancer is still under research, consuming these chemicals regularly could contribute to cellular damage and tumor formation. Opt for fresh, minimally processed foods to avoid exposure to these harmful substances. While these 8 foods pose risks, the good news is that you can actively reduce your chances of developing prostate cancer by making smarter dietary choices. Increase your intake of foods rich in antioxidants, such as tomatoes, high in lycopene, green leafy vegetables, and berries, to help protect against cancer-causing free radicals. Cruciferous vegetables like broccoli and cauliflower contain compounds that may inhibit the growth of prostate cancer cells. Additionally, certain herbs and spices like turmeric and green tea have shown promise in cancer research for their anti-inflammatory and anti-cancer properties. For men at higher risk, such as those with a family history of prostate cancer or related cancers like bladder or skin cancer, it's essential to take preventive measures. Regular checkups, prostate cancer screenings, and discussions with your healthcare provider are crucial. For advanced cases, treatments like immunotherapy, proton therapy, or even Kisqali have shown promising results in targeting specific cancer types, including stage 4 prostate cancer and stage 3 lung cancer. Imagine the millions of men who unknowingly fuel cancer growth with their everyday food choices, only to face late-stage diagnoses requiring aggressive treatments like chemotherapy or proton therapy. Don't wait for a colonoscopy or cancer diagnosis to make changes. Your health starts with what you put on your plate today. Are you ready to take control of your diet, reduce your risks, and protect your future? Small changes now can lead to a healthier, cancer-free life. The choice is yours. And now, keep watching for more health tips.